Yes. So, well, first, my name is Al Freedman, and
Yes.
I'm happy to meet with you and happy to be here. I'm a practicing psychologist, and I specialize in supporting the needs of patients and families affected by rare disease, including SMA and well beyond SMA at this point. The reason that my professional specialization has evolved in this direction is because my son Jack was diagnosed with SMA in November of 1995. And he was only 6 months old when he was diagnosed. He was born healthy, diagnosed at 6 months at a time when there was no treatment at all. So the doctors told us that Jack would live for only 1 year from the time of his diagnosis. That was the news we received as new parents. It was devastating. Thankfully, Jack lived for 26 years, not only 1 year. And I look back with more gratitude than sadness about his life and how much he accomplished in his life. So obviously, the personal experience taking care of a son with SMA has shaped my approach to counseling, shaped my specialization, and has helped me to become uh, the practitioner who does understand what it feels like to have your world turned upside down by a rare disease diagnosis. So that my journey, because it began from a place of really trauma and disorientation, going from having a healthy baby to having a baby who wasn't expected to live another year. That was very traumatic. And when I'm doing my work with other SMA families, patients and families, I'm always aware of how scared they are, how scared we are when we receive life changing news. Even today, in the world of treatment, our landscape has changed because we now have multiple approved treatments in the United States for SMA. So the journey for our babies now uh, and children is different in many cases than it used to be. But even so, our families are profoundly impacted by the news of a diagnosis, whether or not they have treatment that's effective. So um, I am very grateful to those of you who choose to get involved because uh, when you become a member of this club that we didn't choose to join, you feel very much isolated. We feel very much alone. So we're very grateful when other people choose to get involved because we don't choose SMA. None of us do. Um, but people like you who are working hard to improve the quality of life for our family members, um, you're choosing to get involved. You're making a choice. You could be doing a lot of other things, and you're choosing to get involved with us. And I feel very grateful for that. And I know the other members of our SMA community are grateful for that too. Anybody who chooses to get involved with something so complicated, we feel fortunate, whether it's a doctor, a nurse who works. My son had nursing at home for most of his life, a wheelchair repair person, a special education teacher. I could go on and on about the wonderful people who choose to get involved. And then this new generation of SMA, we have people like you and your organization who are choosing to get involved by developing treatments to improve quality of life. And we've seen a huge transformation in our community because of that. I began with our SMA community um, helping to facilitate support groups and providing workshops for our children
Okay.
and families. One of
Yeah.
my favorite things to do is to co-facilitate our children's support groups every year at our conference called Kids Talk It Out. I've done this for 20, 25 years with a partner of mine who has SMA, a teacher who has SMA. So I began by supporting the needs of our own community,
Mhm.
and over the past 5 to 10 years, I have now begun to practice across state lines because of the pandemic in the United States. I'm now permitted to see families outside of the state where I live. So, families with many, many rare diseases are using my support, and I'm supporting patients, families, industry partners, biotech companies like yours, and other rare disease advocacy organizations who are trying to build family support programs. I serve as a consultant to these organizations. I would say beyond SMA, I'm now serving patients, families, and organizations that represent 25, probably 20 or 25 different rare diseases. So I'm learning a lot about a lot of conditions outside of SMA, but SMA is what I know best and is closest to my heart because of my son Jack. The journey and the experience medically between rare diseases and across rare diseases varies considerably. Um, there are some medical conditions that are life-threatening, that are profoundly limiting physically, like my son's had a wheelchair and a ventilator. But there are others that are invisible to the layperson. You can't see that the person has a rare disease, but it's still life-changing and life-threatening. So there are many, many different challenges when you think about the medical symptoms. But when you consider the psychological impact, what I find as a practitioner is there's more commonalities and differences. All of the families that I work with and the organizations have degree of trauma, the change in our life, the life we thought we'd have or the life we used to have is very different than the life we have after the diagnosis. So there's that is common trauma and the disorientation one feels psychologically when receiving a diagnosis. Cutting across all diseases, regardless of physical symptoms, is living with uncertainty, this experience of uncertainty. And it's very hard to live with uncertainty, and that brings a lot of anxiety. There's sort of an existential level of uncertainty. What is my life going to become, and how will I fit into the world? And there's the day-to-day uncertainty. Like, in my case, will the nurse show up for the night shift, or will I be the nurse all night? And is the ventilator working properly under the settings proper? Do we have the supplies we need? Should we take Jack to the hospital? Is he sick enough that we should take him to the hospital rather than keep him at home? These are the day-to-day uncertainty. So there's trauma, there's uncertainty, and then there's also a strong connection with the community. No matter what the disease is, people feel supported by others who find themselves in the same club and who have been there before. So when you don't have a lot of hope and you're traumatized by a rare disease diagnosis, you have all this uncertainty about what your life's going to become, then most people find that talking to other people who've been there is their first and most important level of support. So these are the types, that connection to community, the trauma and disorientation, the uncertainty. These are the type of psychological um, experiences that cut across, in my experience, all the rare diseases, all the cultures and countries, regardless of where you live and regardless of what disease you have. These are the things I see in my practice and in my work, in my consulting work, and which is why I feel equipped to help people outside of SMA as well as people with SMA because their experiences parallel so closely. Well, within our SMA community, within the rare disease community, I should say, our SMA community has been blessed by the transformation. All those years ago, when my son was diagnosed, almost 30 years ago now, there was no treatment. There was no hope, and we were told to expect to have him only 1 year. The same baby now is diagnosed in the United States at birth because all 50 states have newborn screening. And because there are 3 treatment options available, again, in the US and many other countries, but not enough, not all, um, the baby, like my son, who's diagnosed now, is screened at birth and offered treatment immediately. So that child who my son grew up with a wheelchair and a ventilator and a feeding tube and nursing care and special education adaptations and all kinds of needs. And the child now, that same child now with treatment can be walking and can be without symptoms or with minimal symptoms. So we've seen a major transformation that's amazing and beautiful within our community. We are among the minority of rare disease communities that have seen this kind of progress. That being said, with all the encouraging progress, and I've seen these babies running around the childcare room now, not in a wheelchair at our conference, um, we still have a lot of unmet need. and a lot of children, lots of young adults who I know in the SMA community and who I work with still have many unmet needs and use wheelchairs and need a lot of help. So the additional treatments that are coming, including from your organization, are very exciting to our community because to be able to um, build muscle, to be able to improve strength, to be able to find a different route to improve the quality of life is different, it's new and exciting, and it builds on the existing progress that's been made. So while we see wonderful progress, there's still a long way to go. So, to answer your question succinctly, you want to be honest and authentic. You want to show interest in all of our patients and families as people who are facing great adversity and great challenges. And you want to take an interest in what matters to us, what matters to the patients, what matters to us beyond the treatment, too. A lot of the companies that do the best work, in my experience, are supporting programs that help meet the unmet needs of the patient beyond the treatment itself. And because it's hard to have resources when you have a severe disability, it's hard to solve problems creatively because of limitations in society. Because we don't, it's hard to get a job and make money. Then when organizations like yours take a genuine interest and help to support the unmet needs of our family members, it means the world to us. And again, helps us feel less alone and helps us feel supported.